My name's Kevin Wood. I'm one of the medical oncologists and hematologists here. My primary focus is gastrointestinal malignancies, head and neck cancers, and hematology. My clinical role at Valley is focusing on gastrointestinal malignancies, so gastric, colon, esophageal, and then head and neck cancers. And really I'm here to build both of these programs, build the clinical trials for these programs, and provide excellent care to those patients. I went to med school at the University of Kansas. I came out to the East Coast, did my residency at New York Presbyterian Weill Cornell, and then back to the Midwest for fellowship training at University of Chicago, and then now I'm out here at Valley. My philosophy of medicine is really focusing on the patient as a whole. The patients I see are really dealing with sometimes very terrifying diagnoses, and while I want to treat their cancer aggressively, I also want to make sure the patient has good quality of life and is able to deal with their diagnosis appropriately. So pain, the emotional side of things, and also treating the cancer and the side effects from therapy are all very important things to look at when you're treating the patient. Really, we have the best of both worlds here. We have excellent trained physicians who practice evidence-based medicine, and with this new affiliation with Mount Sinai, we have a lot of the clinical trials that they offer in the city now out here, which is a lot more convenient for these patients. What I find special about Valley, I think, is really the people. I'm still relatively new here, but it's really struck me since being here with the nurses, with the staff, with the other physicians. They're focused on making sure the patient can get through this and making sure their quality is good. I think physicians should refer their patients to Valley Mount Sinai Comprehensive Cancer Care, both because of our physicians and because of our affiliation with Mount Sinai. I think we have excellent physicians here who really focus on the patient as a whole and make sure we can both treat these cancers aggressively, but also focus on good quality of life. At the same time, I think this affiliation with Mount Sinai is really wonderful, and we're getting a lot of the clinical trials and a lot of the knowledge from Mount Sinai out here in New Jersey, which I think the patients really appreciate and is a lot more convenient for them.